doing a dressing change. Hi, Mr. Smith. Good morning. My name is Emma. I'm going to be one of your nurses. Can you please verify your name and date of birth? Okay, perfect. Thank you. So then, like I was explaining to you, today we're going to do a dressing change. We have orders to do a dressing change, to change the caps, to take out some blood, to run some labs, some CBC that doctor wants, okay? So I'm going to go ahead and give him some privacy. I'm going to get all my stuff together, all my materials. All my materials. I'm going to go ahead and get everything. I'm going to go ahead and move the bed up to the working position. So I'm going to go ahead and start removing the, changing the dressing. So first, I'm going to go ahead and put on some, wash my hands, put on some gloves. I'm going to go ahead and cover so they won't bother me while I am changing. Tuck it in so it won't get in the way. Assess, inspect, just make sure there's no swelling, inflammation, or anything abnormal. Everything looks good, okay. So I'm going to go ahead and get alcohol. So I can go ahead and remove the dressing, and it's going to be a clean, with clean gloves. So I'm going to go ahead and start removing. Just remember not to tug, not to try to not hurt the patient too much with an alcohol wipe. Just go ahead and start removing it.
Do you have any pain? I am assisting your side and it does not have any red.
Try to hold the skin down so you won't be pulling on it. Just try to remove it. Before you do this, just make sure your medication is on hold and that you're that they're clamped. And you
Paulina.
make sure not to touch the access side. Okay. Okay, now that you're done with that, I'm going to remove my gloves. I'm going to go ahead and prepare my sterile field. So I'm going to go ahead and open this up.
Okay, so before you continue, what other steps do you need to initiate to prevent increasing the risk for?
Mask.
Okay.
So apply mask before you remove.
Yes.
So apply mask on the patient. And then I'm going to go ahead and apply my mask.
Okay, so since it is a sterile procedure and we don't want to contaminate, I am also going to be wearing a mask.
Once the mask is gone, I'm going to go ahead and prepare my sterile field. I'm going to go ahead and get my gloves. Before I get my gloves, I'm going to move this out of the way. I'm going to move this out of the way. So try not to touch anything. So you're going to go ahead and open.
Are you feeling, Mr. Smith, any discomfort?
So I'm going to go ahead and start with this one.
Start with this.
Cover from the inside.
Right.
And then get this other one. Try not to break sterility. I'm going to toss this out to the side. Now I'm going to go ahead and prepare my sterile field. It's going to be shiny side down. Try not to wave it, just drop it. And a 1-inch margin, so just get all your stuff. Okay, so now we're gonna go ahead and start cleaning. This is gonna be my clean hand. That's gonna be my sterile hand. So just try not to touch anything with this one. It's still sterile, so I'm gonna go ahead and remove this. Toss it. And this is gonna be my clean hand. So I'm gonna go ahead and start cleaning. I'm gonna start cleaning back and forth. Cleaning around it. Once I'm done cleaning around it, 2 to 3 inches around it, now I'm gonna go ahead and clean this area out. Okay, so then this goes out. So you're gonna wait for it to dry a little bit. And then with your sterile, you're gonna go ahead and put the patch around it. And again, just inspect that there's no swelling, edema, or anything like that, anything abnormal. So now once it's dry, you're gonna go ahead and now apply the patch and make sure it's in the middle so you're able to see. Just right in the middle. Just make sure it's fixed and everything's mixed together. From the little patch, there should be a little strip there that you're able to write your name. You're gonna write your name, the date, and your initials. Just knowing, putting that you have changed the dressing, and then that will go around this area. Okay, so now it's all ready and changed. So, Mr. Smith, we're also going to go ahead and change out your caps. I see that they're a little dirty. They have some blood on it. So I'm going to go ahead and change those out. So I'm done with the sterile fluids in this area. So I'm going to go ahead and change them out. I changed my gloves. Wash my hands, change my gloves. I've already opened and flushed my caps. The little plastics were thrown away, so.
Just only change one.
Okay. So I'm gonna go ahead and change my cap. So you're gonna go for the distant, for the proximal one. So you're gonna go ahead and
Roxy.
So you're gonna go ahead and remove the cap. Make sure it's clamped. Remove the cap. You're gonna wipe it down for 30 seconds. 30 seconds. You're gonna wipe it down. You're gonna grab your other one. This off and you're gonna connect it. Okay, so you can know you've changed it. Just set it aside. You do the same thing. You remove the cap. You wipe it with the alcohol wipe for 30 seconds, and you're gonna put on the new one. And the same thing, just set it aside so you can know you can change it. Remove this one, wipe it for 30 seconds. Same thing. So once it's already, they're all here, go ahead and unclamp it. And you're gonna flush just to see that they're painting and everything's working. So they're flushed, everything's flushed, everything looks fine. Any pain or anything? No, everything looks fine. Okay, so once we're done with that, okay, Mr. Smith, everything looks good. Like I mentioned to you, I am gonna be taking out some blood. So I'm gonna be taking out some blood for some labs that they ordered. So then you're gonna pause the infusion for a minute, and once it's paused, the same thing, you're gonna go to proximal. So once it's paused, so you're gonna go ahead and clean it. Oh, get your syringes. You need two 10cc syringes, so you can go ahead and draw your blood. So you're gonna go ahead and clean it for 30 seconds. Have your syringes ready, and you need 2 vials for the blood. So one of the syringes you're gonna aspirate. And go ahead and connect. Make sure it's open. You go ahead and aspirate. It's going to be a total of 5 cc's, and this you're going to discard. So I'm going to go ahead and throw this out, and then you're going to go ahead and clean it again.
I am going to unclamp the first one.
Clean it again.
Okay.
And now you're going to aspirate 10 cc's. Clean.
Okay. Unclamp
go ahead and aspirate 10 cc's. Perfect. Once you're done aspirating, clamp it. So there will be pressure, and you're gonna wipe it again. You're gonna wipe it again just to make sure there's no blood and doesn't dry up. So from your 10 cc's, go ahead and clean the tops. You're gonna go ahead and get your needle, and then you're gonna put 5 cc's and 5 cc's. Just make sure that they're labeled, so that way you know what you're doing and who the patient is and inclusive. So any leftover blood goes in the biohazard. So then this gets sent to lab, and we're done with the labs. Thank you so much, Mr. Smith. Okay, Mr. Smith, so now we have an order to remove your CV line. Okay, we don't need it anymore. We already had our blood. We already did everything we need, so now we're going to go ahead and remove it. So for removal, depending if you want to send the tip for blood and culture, you're going to have to do a sterile technique. So the same thing, you're going to go ahead and get some alcohol. You're going to go ahead and remove the, well, clamp, of course, clamp the lumens. Go ahead and remove the tape. And you're going to go ahead, once you're ready to remove, you're going to make sure that you're gonna make sure that the patient's not on any Coumadin products or anything like that. That way you know more or less how much time you have to apply pressure. You're gonna get your 2x2s. You need 2 of them. So you're gonna go ahead and let them know, okay, you're gonna feel a little pressure. Just just go ahead and take a deep breath. So then you're gonna wrap it around your hand so you won't touch the tip, because if you do want to culture the tip, you will want to touch it. So you're gonna go ahead and start pulling it off. Just make sure you verify how long the line is. So once it gets to the tip, once you remove it, you twirl it around your hand. Once you have it, look at the tip that it's not broken off and everything's there. Once you're done, you're gonna bring it over. This is gonna be to culture my tip. Oh, once I'm holding it here, I'm gonna be applying pressure for about a minute. Just try not to touch anything because you do want to culture the tip. Apply pressure for a minute. You just check that there's no more bleeding. You just make sure. Okay, if there isn't any, just go ahead and remove this. You're gonna cut the tip, and that's gonna be sent to lab. So then apply a clean gauze. Just make sure and inspect that there's no more bleeding. Put some tape and just notify him and let him know that once he gets home, if he gets discharged today, to remove it once he takes a shower. He doesn't want to leave it there. So then after that, I do come back after 15 minutes or so to check, make sure that there's no bleeding. So then, okay, Mr. Smith, we're all done. Do you need anything? Are you feeling okay? You're perfect. Okay, I'm gonna go ahead and put the bed down. Cowbell is here by your side. I'm gonna go ahead and put the bed down. And thank you for your time. Take off the mask.